How to use affordable health insurance options properly. Beginner mistakes that cost you. Finding affordable health insurance is possible, but most beginners make mistakes that cost them money or leave them underinsured. You won't believe how small errors can create big financial problems down the line. The first mistake is focusing only on the monthly premium. Affordable plans often come with high deductibles or limited coverage. Calculate your total potential costs, including out-of-pocket expenses, to understand the real value of a plan. Another common error is overlooking plan networks. A plan might seem cheap, but if your preferred doctors or local hospitals aren't covered, you could face unexpected bills. Always check network availability before enrolling. Many people also ignore available discounts or government subsidies. Low-income programs, wellness incentives, or employer contributions can dramatically reduce costs. Missing these opportunities is a common beginner mistake. A surprising mistake is neglecting preventive services. Some affordable plans charge extra for screenings or vaccinations, which can result in higher overall expenses later. Look for plans that include preventive care at little or no cost. Finally, some users rush to enroll without comparing multiple options. Even affordable plans can vary widely in coverage, network, and total costs. Take time to research multiple providers to find the best fit. To properly use affordable health insurance options, consider total costs, verify networks, check for discounts and subsidies, prioritize preventive care, and compare multiple plans. Avoiding these mistakes ensures you get real savings without sacrificing protection.